Your Excellency Samia Suluhu Hassan, the President of the United Republic of Tanzania, Your Excellency Dr. Hussein Ali Mwinyi, President of Zanzibar, Your Excellency former Presidents of the United Republic of Tanzania and former Presidents of Zanzibar, Your Excellencies former heads of states and governments and friends of late former President Benjamin William Mkapa, First Vice President and Second Vice Presidents of the Revolutionary Government of Zanzibar, Mama Anna Mkapa, the widow of the late President Benjamin William Mkapa, honorable ministers from the Union Government and the Revolutionary Government of Zanzibar, members of diplomatic corps, our esteemed partners and donors, chair and trustees of the Benjamin Mkapa Foundation Board of Trustees, family and friends, ladies and gentlemen. It is our pleasure to have you, Your Excellency, President Samia Suluhu Hassan, with us this morning. We thank you for sharing with us your precious time. We just saw you arriving yesterday from Dodoma to be here with us and grace this commemoration. Tunasema asante sana, Mama. We started with the panel session, which you found it on the midway, with this main focus on health for all. As you may recall, Tanzania and other countries in the world are committed to implementing the Sustainable Development Goals, which are anchored on the premise of not leaving anyone behind. In the third goal, our country and the world have committed to ensuring universal health care by 2030. The aim is to ensure that everyone, everywhere, all the time, can have unhindered access to quality health care, but whether it is distance-related or income-related. We are delighted that your government is keen to achieve that. The just launched Health Sector Strategic Plan 5 of 2021 to 2026 has anchored on the same. We, the Mkapa Foundation, have a vested interest to see that commitment is delivered and stands to support your government in all ways possible. We were part of the HSSP 5 preparations and will be part of its implementation. The panel today was just a teaser towards that end. It reflected on what to be done by the government, non-state actors and donors to achieve the universal health coverage in Tanzania. Human capital, health infrastructure, health systems, community health systems and resilience, financing matters were all among the issues that came out from this panel. Your Excellency, the late President Benjamin William Mkapa was always ahead of time. His vision for this foundation, way back when it was established 15 years ago, was to focus to ensure quality health for all, the far-to-reach and underserved areas. These are places and spaces with fewer projects, interventions, and donor-supported initiative. The strengthening of the health system, human resource for health and health infrastructure became our major focus areas of support. He challenged us to ensure that we come out with solutions that will answer these challenges. And that has been the niche of this foundation. Your Excellency, ladies and gentlemen, you may wish to know that since our establishment, about 20 million Tanzanians have been reached out and benefited by our programs and interventions. About 9,000 plus health workers have been employed and deployed to underserved areas, and these include skilled medical professionals as well as community health workers. This perhaps makes Mkapa Foundation the second largest employer in the health sector after the government. We have about 537 health facilities that have been built and rehabilitated countrywide. During the COVID-19 emergency, which we had it from March 2020, we worked very closely with the government and deployed about 2,500 community health workers to assist with the community education and facilitation. Your Excellency, behind all these achievements, there is a vision of a man, the one we are commemorating today. He did so much to his country while in office and after his term ended in office. He dedicated his life to the poor and underserved. We feel strongly that we have a duty to honor his life and celebrate his legacy. We're determined to carry over from where he ended and doing our level best to keep his ideas and conviction immortal and impactful. It is why we commemorate this day from now onwards. I welcome Your Excellency to be with us, and we are all excited to hear from you today. Asante sana. Thank you for your attention.
Kwa mama yetu Ana Mkapa pamoja na familia, nataka niwahakikishie kwa serikali ipo na itakuwa pamoja nanyi kwa kila hali. Na hapa nataka niwape taarifa ndugu zangu washiriki wa kongamano hili kwamba mbali ya mimi kumfahamu Mzee Mkapa, lakini nimebahatika pia kulelewa na wote, Mzee Mkapa na Mama Mkapa. Mzee Mkapa nilisafiri naye mara nyingi nikiwa waziri wa kazi, vijana, maendeleo ya wanawake na watoto katika mikutano ya kimataifa. Na mara nyingi alipenda nisafiri naye kwenye ndege yake. Wakati wa safari alinifunza mengi sana. Lakini kwa upande wa pili, Mama Mkapa, mimi nilikuwa mjumbe wa bodi ya taasisi ya Mama Mkapa ya fursa sawa kwa wote au EOTF. Nilifanya naye kazi kwa miaka minne, 1996 hadi 2000. Lakini ilikuwa ni Mama Mkapa na wajumbe wenzangu wa bodi walionishawishi sana kuingia kwenye shughuli za kisiasa. Hivyo mwaka 2000 nikamuacha kwenye taasisi nami nikaingia shughuli za kisiasa. Kwa hiyo namshukuru sana Mama Mkapa. Dr. Hussein hapa alisema alivyo leo ni matunda ya Mzee Mkapa. Kwa hiyo nilivyo mimi leo ni matunda ya wengi sana, lakini pamoja na Mzee Mkapa na Mama Mkapa. Kwa marafiki zetu na wahisani na wadau wetu wa maendeleo, na wasihi muendelee kushirikiana nasi na kuiunga mkono taasisi ya Benjamin William Mkapa ili iendelee kuwahudumia mamilioni ya Watanzania. Nimefurahi na kupata moyo kuona waheshimiwa mabalozi pamoja na wawakilishi wa mashirika ya kimataifa wako hapa pamoja nasi wakishirikiana na taasisi hii.
I am honored that you've invited me to join you and the Mkapa Foundation today to celebrate the life and legacy of our friend President Benjamin Mkapa. I want to begin by sharing my deep condolences with you and all the people of Tanzania on the passing of two presidents in less than 1 year, President Mkapa and President John Magufuli. I was proud to work with President Mkapa when I was President of the United States and through the Clinton Health Access Initiative, or CHI, after leaving office. In 2002, he invited CHI to partner with the government of Tanzania to expand access to HIV/AIDS treatments and save the lives of thousands of Tanzanians dying from the virus each year. As CHI worked with global manufacturers to reduce drug prices, the government, under the personal leadership of President Mkapa, worked with our support to strengthen the health system, including the expansion of HIV testing laboratories, supply chain health infrastructure, and data systems. The vision and commitment shown by President Mkapa helped make Tanzania the first country in the region to have a comprehensive and government-led antiretroviral program. I congratulate the government that those efforts have only continued to grow stronger. President Mkapa was also passionate about strengthening human resources for health. And in 2005, we joined together to create the Mkapa Fellows Program to address the health worker crisis that was hindering the scale-up of HIV care and treatment services. The program used creative strategies for attracting and retaining health workers in remote areas, including deploying teams of highly skilled providers in hard-to-reach facilities. On my visits to Tanzania through the years, I was always pleased to visit with Mkapa Fellows and see their progress. I am so gratified that the work of the Mkapa Foundation is now expanded to address other health issues beyond HIV/AIDS, including the pursuit of national universal health coverage. We can't shy away from the need to have well-organized primary health services, a robust disease surveillance system, adequate domestic capacity to innovate and scale up production and logistics of much-needed medical products, and a flexible system that can learn continuously and adapt to meet changing global health needs. CHI is committed to working with the government of Tanzania to achieve this vision and to continue addressing urgent health challenges, including HIV/AIDS, malaria, vaccines, reproductive health, non-communicable diseases, and the COVID-19 pandemic. So thank you again for the opportunity to be part of this special tribute. I liked and admired President Mkapa very much. And my very best wishes to all of you and to all the people of Tanzania.
An honor to say these words in celebration of the life and achievements of Ben Mkapa. Ben started, as you all know, mentored by Julius Nyerere. He was Minister for Foreign Affairs at the time of the liberation struggle across Africa. He played an enormous part under the guidance of President Nyerere, his mentor. But then, when he became president of Tanzania, his achievements were quite extraordinary. He inherited a very difficult set of economic circumstances. He stabilized the currency. He reduced inflation dramatically down, I think, from 27% to 4%. He increased foreign direct investment in the country ninefold. And he built a lot of what is today Tanzania's modern infrastructure, particularly on roads. I knew him, got to know him most through his work with the Commission for Africa, the body that was set up prior to the Gleneagles G7 summit in 2005, where Africa was going to be one of the main topics. Ben's contribution in the run-up to that summit was immense. He was a passionate advocate for the continent of Africa. And out of that came the commitments to debt cancellation that Ben himself then used as president in order to be able to change radically the number of children at school, not just in Tanzania, but across the continent. Then, of course, after leaving office, he founded the Ben Mkapa Foundation that bears his name, that does such amazing health care work, that has advocated, for example, not just in respect of HIV/AIDS, but across the whole pattern of healthcare needs in Tanzania and elsewhere, and is a big supporter of universal health coverage. I think he'd be immensely proud of the work the Foundation's done on his behalf and in his memory. So I look back on my time and my friendship with Ben as one of the most rewarding political associations I had in my time in office and afterwards. And I regard him as someone who was an outstanding leader, a great patriot, a statesman, a campaigner, and a warm and decent and good-hearted human being. So it really is for me, as I say, a pleasure and an honor to say these words in support of his commemoration. His name lives on. It deserves to live on. His legacy is one of which he and all who work with him can be immensely proud.